so you have this very complex landscape that you have to manage in so that you can have a true preventive medicine.
Yeah, and that would imply, so basically what you're saying is, you know, we can call one symptomatic manifestation, a disease like IBD or whatever, but you and I could present with similar symptoms and get diagnosed with IBD or something similar, and yet the pathophysiology is very different. The origins of how that got started are completely different or
That's
largely different
correct.
between you and me, which would therefore imply that the treatment that works for me is likely not going to work for you.
That's correct. And the prevention strategy is going to be very different. And so I'd like to tie this. I really like this metaphoric comparison with Airbus A380. And so there are many reasons why a complex airplane like that is down, meaning that it is unable to fly. Many
Mm-hmm.
reasons, right? Because there are so many systems in that airplane. And so when someone says, "Oh, engine 4 is disabled," right? That would be like saying this plane has IBD. But wait a minute, engine 4 is not like one block that's either working or not working.
Mm-hmm.
It has thousands of components in it, and any number of combinations of faulty components can lead to that engine not working, right? And so the way I think about it is that we have many, many different kinds of diseases, many overlap, and each one of those, again, multifactorial, and then in each person, there's different factors that can go wrong. So what we need to do is exactly what we've done for airplanes, which is understand all the parts that contribute to a healthy, functional airplane, have a yearly or quarterly testing of every single part that contributes to that healthy airplane. And then every time that we find a faulty part, we fix it immediately. We don't say, well, it's just one part. The engine is not broken. We can wait until a few more parts break down. Because if we wait for a few more parts to break down, now the plane crashes.
Mm-hmm.
And in that world, humanity has decided we do not tolerate planes crashing for maintenance reasons. We're not going to tolerate 400 people dying because we know how to prevent it. On the human health side, we as humanity have decided it's okay to wait until you're sick and dying because, well, that's how healthcare makes their money. And so that's the foundational sort of mindset that we have to change, is that we can in fact completely bring preventive maintenance to the human body. We just have to do it. And the main challenge has been that no one has basically designed a business model where people are willing to pay for preventive maintenance. And I
Mm-hmm.
think that
Mm-hmm.
that's really the key.
Yeah.
If there are now many ways in which you can reduce the risk of chronic diseases and cancers. They are very well known. But how do you get someone to not eat something that they love
Right.
is a big problem. How do you get people to exercise when they don't like to exercise? That is the main problem, I think, with preventive medicine, is
Mm-hmm.
that people actually have to do something about it, just like what we're doing with airliners. The airliner is not going to fix itself, and it's not going to be healthy forever. There's an army of people actually doing work to maintain that. And so it takes work. So that's really the biggest challenge, I would say. And that challenge has always been because, hey, I'm not going to stop eating steak because my uncle ate steak all his life and he lived to 95.